This is according to Chief Medical Officer Dr. Narain Singh, who was a guest on the Ministry of Health Matters show last week.
Childhood cancer is responsible for the most common cause of death among the child and adolescents population. That is the population between 1 to 19 years old. It is one of the most common cause of death among that population. In Guyana, we see the 5 most common childhood cancer include, the most common one is actually the leukemias, acute lymphoblastic leukemias, which account for about 69% of the cancers that we see in that population.
Acute lymphocytic leukemia is a type of cancer of the blood and bone marrow, the spongy tissue inside bones where blood cells are made. It can also occur in adults, though the chance of a cure is greatly reduced. While childhood cancers are not easily detected, Dr. Singh said that there are some signs and symptoms to be on the lookout for.
Many times when we see when a child is diagnosed with cancer, it's sometimes usually late, and that impacts on their prognosis. And so we wanted them to, members of the public, to be aware that cancers do happen in children and in adolescents population. And sometimes a lot of the signs and symptoms are actually sometimes subtle, and they can be mistaken for some other minor illnesses. And a lot of the time they do present with symptoms, but when they do get diagnosed, it is usually sometimes late. And this impacts on the prognosis in terms of what we can do for them in terms of treatment, or if we can help actually cure the cancer.
The health ministry, he noted, is equipped to provide treatment and medication for childhood cancers and even provide financial assistance for overseas treatments. Childhood Cancer Awareness Month is observed every September to create awareness of the impact of cancer in children and their families around the world. Kerese Gonzales reporting for HGP Nightly News.